Hi, this is Dr. Nanavati. How are you doing? According to the FDA, prescription drug errors are responsible for 4 million hospital visits per year. These are emergency room hospital visits. That costs us, you and me, taxpayers, $4 billion in healthcare dollars are spent per year for prescription drug medication errors. What do I mean by that? I mean, they could be wrong, the wrong medication is given, the wrong dosage is given, an omission, so a medication isn't given when it's supposed to be given, allergic reactions, and drug-drug interactions. Okay, so how do medication errors occur? Well, there are usually multiple doctors involved in the care of a patient. There is usually a primary physician and there are multiple specialists. And so often what happens is one of the specialists starts a new medication and that does not get communicated to the other physicians involved in the care of the patient. Second of all, hospital visits. There's a routine in the hospitals that medications are supposed to be given and prescribed prior to their discharge. There are new medications that are often started, and there are sometimes changes in medication dosages that they were previously taking. This results in confusion, and sometimes the patient takes the new hospital medications and doesn't take the older medications, or they take the hospital medications and take the other medications, which result in redundancy. So these things can play a factor. Finally, patient-related issues. So the patient himself or herself forgets to take a medication when they're supposed to. Often occurs when you have to take things 3 times a day or 4 times a day. Wrong dosages. Sometimes they take half the dose they're supposed to take or the full dose. Finally, running out. They plain run out of the medication and they didn't refill the medication, and then they wind up in the hospital because they ran out of, say, an important critical medication like a diuretic or something, and they end up in heart failure. These stories are countless. Finally, they're not understanding the actual instructions for the medications. For example, some of the medications need to be taken at night only. Some medications need to be taken only in the morning, and other medications need to be taken as a PRN, like only if something happens, like only if you have chest pain, then you take this medication. So if you don't understand the instructions, things can go bad pretty quickly. So therein lies the reason why there are 4 million hospital visits per year for medication errors. Okay, so what can we do to prevent medication errors? First of all, bring a list of your medications with you on every doctor visit. Doesn't matter who it is. It could be your primary doctor, it could be your specialist, doesn't matter. And if you can't bring a list or you can't make a list, then just put all the medications that you're taking in a brown bag and present it to the physician. And they will take these medications down and put it and make a list for you. And insist on taking that list home with you, okay? And then share that list with the other doctors when you go there, okay? If you were in a hospital, bring that list of medications they started you on to the doctor's office so that he knows or she knows what new drugs were started, okay? And they can make an adjustment. And then finally, please tell every doctor you're involved with about any allergic or adverse reactions you may have so that they know not to prescribe drugs that could cause those adverse reactions. For example, if you're allergic to penicillin, then your doctor will know. And if you tell your doctor that you're allergic to penicillin, they won't prescribe cephalosporins because there's a 10% cross-reactivity. That's just an example. There's lots of other allergic reactions. As long as you know that you had an actual allergic reaction, that means you broke out in a rash or you've got faint or your tongue started swelling up, that's a true allergic reaction. If you had those kind of allergic reactions, let your doctor know. Finally, if one of your doctors makes changes on those medications, please write that down and show it to the other doctors. It's imperative that you be the one that show and the list of medications to your physicians, because we cannot trust the current system. The EHR system doesn't cross communicate. Therefore, it's up to you, the patient, to prevent medication errors. Thank you so much for your attention.